So my name is Anika Gianforti. I'm a dairy processing specialist with Cornell Cooperative Extension. And thanks for tuning in to Dispelling Consumer Myths and Learning the Facts about COVID-19. To give everyone a little bit of background here, one of the reasons we wanted to hold this is because we know that one of the huge strengths of the extension system is that folks get to interact directly with those communities that they're a part of. And we know that you're receiving a lot of questions, particularly around food and food safety during the COVID-19 pandemic. So we wanted to go through and dispel some common myths and give you some language and some thought processes that you can think through as you're answering questions. We also wanted to point out different places that you could get information online and through our online resources. And then we'll hold a question and answer session. So we have some questions that were already submitted that Director Watkins gave us and questions that you submitted when you registered. And we'll also open it up for question and answer at the end. So at that time, we'll open that up. If at any time you have questions, you can type them into the chat box. So some quick housekeeping rules. This webinar will be recorded. We'd like to be able to share it internally with other folks throughout Extension who weren't able to tune in at this time. Again, we'll be asking for questions at the end, so submit those in the chat box, or if you're on the phone, we'll give you the opportunity to unmute yourself. With that, I'd like to introduce our panel today. So first, we have Dr. Martin Wiedmann, Gellert Family Professor of Food Safety. We also have Dr. Sam Alkane, Assistant Professor in Dairy Fermentations, and we have Dr. Aliosa Termchich, and he is an Extension Associate in our Food Science Department. And with that, I will turn it over to Martin to cover some cases.
Thanks, Anika. So what I'm going to try to do is really take some of the most commonly asked questions and challenges we've heard people grapple with and sort of unravel them a little bit. And I'm not just going to tell you, okay, this is what it is and this is what you have to do, but trying to really sort of lay out the pros and cons, why there are different opinions out there, and how we can ultimately arrive at a conclusion and advice that we provide either to our families or to people that we work with or to our constituents and stakeholders that are the right advice and will help people deal with this appropriately. And obviously COVID-19 challenges us in so many different ways with regard to communication and finding and providing the right advice, right? It's an organism we know little about. The scientific knowledge is changing very quickly. People are extremely afraid of it. We've seen increasing sort of bipolarization of people. Some of them saying we completely overreacted, this is ridiculous. Other ones just, probably want to just stay in their basement and never ever leave it again. And just want to, dunk all of everything they bring in their house in undiluted bleach and anything in between. And so we need people that are able to sort of cut through the myths we hear, the endless onslaught of videos and tweets we get about what to do and what not to do, to really provide people with the correct and the best, shouldn't say the correct, the best advice we can at this point. So the first example that I'm going to use to illustrate how we can do this is the whole question around what should I clean and sanitize and what shouldn't I, and why should I clean and sanitize some things and others not. And one thing that we have seen this sort of hit sort of an interesting point is sort of around grocery shopping. When you go grocery store, you usually get disinfected grocery carts. You have wipes sometimes to disinfect your grocery cart, and obviously you're supposed to disinfect your grocery carts. But on the other hand, some people tell you when you bring your groceries home, you don't need to clean and sanitize the outside of your groceries, of your canned goods or your clamshell boxes with your blueberries. You should just put them in the fridge, wash your hands after you're all done, and use them as regularly. And people are like, those two things don't make sense together, right? Because it's the same environment, grocery store. Intuitively, we can see both could get contaminated, right? The grocery cart as well as, I'm going to take the proverbial blueberry clamshell. So why one and not the other? So let's unravel a little bit what the difference is. So one of them is, actually stay with the previous slide for a second. Okay. One of them is that grocery carts are so much more frequently and commonly touched than products. You know, you hold your grocery, if you think about the total amount of time you spend having the hands on your grocery handles, it's considerably longer than if you touch something and put it back on a shelf, for example. So what it means is the likelihood of contamination of grocery cart handles is extremely higher. If you go to the grocery store even 15 and 20 minutes, then there's the risk of you touching the handle, touching your face, getting this close to your nose or eyes where you could get transmission. And so the challenge with coronavirus and with all infectious diseases is transmission is a numbers game. Anything can happen, but a lot of things almost never or never happen. It doesn't mean they couldn't happen, it can happen. With a grocery cart, there's considerable risk because of the frequency of touching and that sort of transfer from the grocery cart to your face where you could contaminate yourself. And that's why we disinfect grocery carts. On the other hand, if you think about, again, the proverbial blueberry clamshell you bring home, that might have been touched by one person very quickly, not long contact. You don't hold on to that box for, 10 minutes, 15 minutes, but you touch it briefly. So the likelihood of transfer is lower because of the shorter time you touch it. If that blueberry clamshell got contaminated, it probably was a while ago, despite the fact what we hear about the virus surviving on surfaces for 2 to 3 days. Over those 2 to 3 days, the amount of virus dies off every couple hours. Every couple hours, 2 to 6 hours or so, you get half of the virus. So it degrades over time. It's not just it stays there for 2 days. So with that, you have an extremely low likelihood of your clamshell, the outside of your food, being contaminated, and of that contamination and transferring to you and infecting someone, which is why we provide, this sort of different advice. Now, most people hear me say that, or hear anyone say that, say, yeah, that's fine, I get it, but it can't hurt if I clean and disinfect my groceries, right, my clamshell, etc. Because I just want to be super careful. I want to do anything I can, and even if there's only a 2% chance it'll help, I still want to do it. Well, and this is where the problem comes in. And now we go to the next slide. And this is the common logic. Basically, people say, well, anything could happen. And if you look it up, you could get struck by lightning even if you're indoors. It happened. And if you look at this article, it says it happens more often than you think. So can I be here as a scientist and tell you, I guarantee you no one ever will get COVID-19 from touching the outside of a food container? No, I cannot. And I will not. And most people are not, this is important to say that. But the likelihood is so low, the risk is so low, that the things you would do to reduce that risk even further, from virtually nil, less than getting struck by lightning indoors, to less than that, you do things that actually increase your risk of getting sick or maybe even acquiring COVID or other infectious diseases. Now let's go to the next slide. One specific example here is, there was a lot of advice out there about cleaning and sanitizing more, disinfecting more, disinfecting your groceries, and as a consequence, is called to poison centers in the US with regard to exposure to cleaning and sanitizers went up considerably, as seen in this slide. Next slide. Here's one very specific example that has to do with washing groceries before coming home, after coming home. So this is an adult woman, and you guys can read as fast as I can, decided she has to clean and sanitize all groceries. So she fills a sink with 10% bleach, adds vinegar, hot water, and you start to get chlorine gas. And you start to get difficulty breathing, coughing, wheezing, 911, you get to the hospital. So you might say, okay, that's bad, but look, she survived. She was discharged after a few hours. Now, let me ask you one thing. She may have reduced the risk to get COVID-19 from the food packaging. It was already less than being struck by lightning indoors. But now she had to go to the hospital, had to be transported there, had to be there. that is a much higher risk of exposure to COVID-19 that she created now than she prevented by doing what she did. So we finished with this case study, which shows that, you know, when we have extremely small risks and we're trying to manage them, that we often will create more harm than we prevent. And this is the important take-home message here. Let's go to the next example, which is another one that sort of people struggle with. Is the question is, how can COVID-19 not be foodborne? I think that got particular concern once we heard that diarrhea is a symptom of COVID-19, and so people, common sense tells us if you have an illness that can result in diarrhea, that must be foodborne, meaning you can acquire it by consuming food. Now, the important thing here is COVID-19 is not foodborne. COVID-19 is predominantly transmitted through person-to-person contact. That's the number one route of transmission. That's why we have social distancing. That's why we have face coverings to prevent that person-to-person transmission through droplets. Everything else is a much lower risk, including surfaces. And that is one of the key take-home messages. We need to focus on preventing that person-to-person transmission. So why is it not foodborne? This is another interesting study, case study, where again, it's not one piece of evidence, but it's multiple pieces of evidence together. Number one is epidemiology. Diseases that are transmitted from person to person have different patterns of spread than diseases that are transmitted through foods. Transmitted through foods, they spread further because the food moves further, etc. None of the studies on the epidemiology or transmission of COVID-19 found any evidence for foodborne transmission routes. Now, people might say, well, that's good. Epidemiology isn't an experiment, and maybe just because we don't find evidence doesn't mean it doesn't happen. It's the old adage of absence of evidence does not mean evidence of absence. In this case, would be evidence that foodborne transmission is absent. There's the second piece that comes in that is really important. There are foodborne viruses. All foodborne viruses are non-enveloped. What that means is these viruses have an outer protein coat that makes them very resistant to things such as acid, for example, the stomach acid. COVID-19 is an enveloped virus. Enveloped viruses basically have a fat layer around them, not a protein coat, and they're very, very sensitive to environmental stress, including acid. So COVID-19 will and would be killed by stomach acid if you ingest the virus and cannot be transmitted through food. Now the question is, okay, let's assume I believe what you just said, but then why diarrhea? If you have close person-to-person contact, you get infected with the virus then can get in the bloodstream and spread through the bloodstream to your intestine, effectively bypassing the low pH environment of the stomach. So that is how you get diarrhea, despite the fact that this is not a foodborne virus. So we combine this with the previous conversation we had. It basically means transmission through food in any means, whether it's the outside of the packaging, the food itself that you consume, touching the product, touching you, is excessively low. So low that you should not sanitize the outside of your food packages because you will create bigger risks, as we have seen. So low that CDC, Centers for Disease Control, the European Food Safety Agency, any agency that does anything to do with infectious disease control says, do not clean and sanitize the outside of food packaging because the risk is so low and the potential problems that you create by doing this are so much higher. Focus on the key strategies. Wash your hands when you come back from the grocery store. Keep your distance while shopping. Keep the 6-foot distance. Wear a face mask correctly. That's what will help us. Not going overboard with other things that are not going to further reduce those risks that are basically, for all practical purposes, non-existent. So that's around shopping. Now, the question often becomes, and I've heard this, you know, Martin, why should we trust you? Move to the next slide. Weren't you one of the guys that said, you know, 5 weeks ago, we shouldn't wear face masks. And now you're telling us we should wear face masks or face coverings when we go shopping. How do I know that you're not going to come in a week from now saying, oh yeah, we should clean and sanitize the outside of our groceries. We should, COVID-19 is foodborne. It is a real foodborne disease. Yes, I was one of the people who said 5 weeks ago, we should not recommend broad use of face masks. Why did this change? Why did I change what I communicated, and why did CDC change what it communicated? This is the thing what I mentioned first. This is a rapidly evolving situation, was and still is, where not just our scientific knowledge change, but also where we have changes in the epidemiology and in the frequency of the disease. 5, 6 weeks ago, we were looking at a tremendous shortage of face masks, particularly the N95 face masks that are important for medical workers. If there would have been a recommendation for face masks, we would have further reduced the ability of the people that needed these face masks the most to acquire them, which was one reason why they were not recommended. At that point, it was not clear how many people can actually shed the virus before they have any symptoms of either fever or coughing, which is something that's became apparent. And the number of disease cases went up tremendously to a point where using face masks became prudent. Now, there still are a number of risks associated with face masks that often may create a net effect of using them that's not beneficial. For example, people that wear face masks may be less likely to follow social distancing. This is not really an either or. You need to maintain your social distancing to minimize reduce the risk of transmission. That 6-foot distance is absolutely essential. People who have face masks might touch their faces more often. That's a high risk factor for transmission because people have to adjust them. So there are reasons why to be very, very careful, but we will have situations where scientific evidence changes. With regard to foodborne disease transmission, that one is not going to change because the biology of the virus makes it very clear that envelope viruses will not survive the stomach acid. An envelope virus cannot evolve to become a non-enveloped virus. That is something that has these are completely different viruses. It takes millions of years to become that different. So, but this sort of illustrates hopefully sort of the range of recommendations, the range of challenges out there where often our common sense betrays us. I guarantee you, even after this conversation, there will still be people on this call and otherwise who are like, you know what, I hear what you're saying, but I'm still gonna disinfect the outside of all my groceries. Now I just learned that I have to be really careful what sanitizer to use, and I know how to do it, and I wanna manage this extremely low risk. That is a problem because there are other risks that we didn't talk about. You start cleaning and washing your groceries, going through all of these things, paying full attention during that time to not touch your face, continuously to really follow these key strategies becomes more challenging. People cannot do 10,000 things at the same time and focus on all of them. People will watch and see you doing this and therefore emulate you. And we will have issues with that. We need to have consistent messaging here. And that's one of the reasons why I changed my advice on face masks. Partially it is important that there's a consistency in messaging. Even if I'm not 100% clear with face masks, and if I think sometimes the risks may outweigh the benefits, I will say people should wear face masks because we have to consistently communicate. Because if I, as an expert, said, no, don't wear face masks, then everyone else says, well, so we don't follow any of the government's guidance. For us as educators, sometimes we have to fall in line with recommendations to send a consistent message. Once we do not send consistent messages, people doubt all of them, and we will recommendations that come from CDC and FDA, and we will have a tremendous increase in risk of COVID-19 transmission. So that's what I had as an overview. I'm turning it back over to you, Anika.
Thank you, Martin. All right, so we were going to go through that website, and Al did a great job of going through that. Just some final notes on that. I'm sure some of you were already aware of that resource, and for others that was new to you. I would really encourage you to explore in particular the consumer frequently asked questions page, because a lot of the questions that we've received through the grapevine are covered there. So I would encourage you to use that as a resource, and please feel free to reach out to us if you need guidance that wasn't covered in that consumer frequently asked questions page, because I'm sure if you have a question, then a lot of other folks also have the same question. So that being said, we're going to start getting into the question and answer session. I'll start out with a few different slides on things that were already asked when people registered. So one of the first questions we have, is meat safe? We see in the news that many employees at meatpacking plants are sick or have died. So I'll turn that over to the panel.
Yeah, I'll jump on that one, Nika. Everyone can hear me, right? I'm unmuted? Yes, all right.
Yep.
So let's talk about that question. There's a few different issues here, right? In that question, is meat a risk? Are meat workers at risk, or are they a risk? So first, let's start off with, is meat a risk? So first off, right, we're well into, unfortunately, right, this pandemic. We've got, nearly 1.5 million cases in the U.S., over 5 million cases, right, worldwide. And so there's been a lot of opportunities, and Martin's talked a little bit about some of those, to start doing epidemiological studies and trace how the virus spreads between people. And looking at the studies, they've done studies, right, on cruise ships, in restaurants, right, in communities. And what it suggests is that it's not food, right? Food is not coming up as a vector, right, in those studies, right? So it suggests that meat is not a significant transmission vector. It's really all around, and this kind of goes back to some of what should we be focusing on. It's really around close person-to-person contact, right? And those are the challenges that we're seeing in these meat packing facilities, right? Employees are working closely right next to one another for a prolonged time, and there's the chance then of some of these, right, droplets, these, saliva droplets to then transfer from one person to another, right? And that's what we really need to be watching out for. That's the issue with these meat facilities. It's not meat being put at risk. It's the challenge of person-to-person transmission, and how do we control that? And I will note, when we, again, people think about food packaging and food itself. When we look at the preventive strategies that we've put in place, particularly here in New York, which have been around: social distancing, hand washing, face coverings, right? Not touching your face, right? We've done that pretty well. People are still buying groceries, still eating food, still handling packages, but those mitigation factors have, right, flattened, and now we see the curve dropping off. So that is the main way to control it. This worrying about packaging and things like that, those are not the main routes of transmission. So, right, so that's where, right, food is not, and meat is not a source that we should be particularly worried about. Now, theoretically, right, Martin talked about there's always a theoretical risk, right? But again, we know that, say there was a worker that coughed on the meat in the processing plant, right? That virus is going to start to become inactive quickly, right? We talked about its half-life. So it's going to start, right, degrading over time, right? And so it would have to be at a really inconceivably high load to remain in the meat by the time it gets to the store, right, for it to even be an issue for you, right? And then lastly, right, most of the meat that we eat, right, comes in raw, and we need to cook it. And we know that heat destroys the virus. So overall, right, the risk from meat as a source of the virus is extremely low, and is not something that we should be consistently worrying about. What we should be focusing on is our person-to-person interactions to control the spread of the virus.
Great, Sam. And there was another follow-up question there about a lot of folks have heard about the executive order that forced some of the, forced in the media, those meat plants to remain open. Could you comment on that?
Right. So there was an executive order, right, that was signed by Trump that gives the Secretary of Ag, Sonny Perdue, the power to invoke the Defense Production Act to keep companies, right, from closing their plants and running. Now, to my knowledge, while they've signed that executive order, that order has not actually been used to keep any of these plants open, okay? These plants, these companies are working, right, to adjust the way, right, they have their workers within their facility. They're also thinking about how they engage in the community, how they live in the community, to then reduce the chances of person-to-person transmission, to keep get the plants back up and keep them running, right? And so far from what I have heard, right, a lot of these plants are beginning to come back online, right? So we had a couple weeks, it's been about 2 weeks already since those plants were starting to shut down, and they're beginning to come back up. And I haven't heard any issues around understaffed plants not being able to follow just the regular food safety practices that they need to follow to make, regularly safe food. So when you're thinking about things like salmonella or E. coli, those practices are still there, and those plants are still being, right, inspected by USDA officials, right? So the food safety piece is still being maintained, when we're not talking about COVID-19. And so, right, it hasn't been, the act hasn't been used, and we're still producing safe food. And I think we're going to see more and more plants coming back online and then staying online as things progress.
Thank you. All right, we're going to move on to the next question. Is it safe to pass someone in the grocery store even if both of us wear masks?
So let me take that one. The mask, and this is very important, the masks are not there or have limited effectiveness of protecting you from someone else. The goal of the masks is to make sure that people who have the virus, who are actively shedding the virus, reduce the risk of them transmitting it to others. So it does not protect the recipient as much as it quells the source of it. Now, if you pass by someone and it is within a less than 6 foot range, both of you don't talk, both of you wear face masks, and that sort of passing is an extremely short time frame, the risk is excessively low that anything will happen. If you pass someone in a grocery store at a 4 foot distance and the other person wears a face mask but not over their nose, and you wear your face mask not properly over your nose, and that other person has COVID-19 and sneezes, then the risk is considerably higher, okay? So in general, and we have to reiterate that 6 foot distancing is essential, and wearing face masks properly at the same time tremendously reduces the risk. Try to stay away further than 6 feet. Do try to avoid any situations where you get closer than that. If it happens to you, there's no reason to freak out and get tested, because the risk under most normal circumstances will be low. But we can conjure up situations where there will be some risk from this. But a typical sort of just walking by someone quickly is going to have minimal to no risk, particularly if you're in an area with low transmission. Now I'm going to go back to my previous conversation because I saw a few things in the chat, and some people continue to draw the conclusion, well, isn't it still safer if I disinfect the outside of my food packaging? Better safe than sorry. I'll leave you with one other thought. Would you wear a helmet when you drive your kid to your school around the corner in a 30-mile zone? After all, better safe than sorry, a helmet provides additional protection. You probably wouldn't, and nor would we recommend this to anyone, even though that better safe than sorry logic might apply to that too. Why? Because with a helmet, you have a harder time to see your blind spots, turn your head, etc., and you actually invite other risks that are higher than the added protection. So the better safe than sorry approach and logic does not always get us to a situation where we make good, smart, and the best decisions for ourselves and those around us that we care about.
Great. And while we're still on the grocery conversation, there's a couple questions from the chat. Is there a significant risk of transmission from grocery carts to reusable shopping bags placed in carts?
There's again, is it a risk zero? No, it is negligible enough that that you would not worry about it. You do not need to manage this risk. The grocery carts, and most of them are disinfected. It is the handles where there's the high risk, because it's closer, you're closer from touching your face, potentially contaminating the handle. It's really all about, if you want to have additional protection, wash your hands. And it is important that you wash your hands when you come home from the grocery store as soon as you can. And it's that sort of enhanced hand washing that really is the key. The transmissions through surfaces, we hear so much about cleaning and sanitation. This transmission through surfaces is by far secondary to the air transmission through person-to-person contact. That is the number one risk we need to manage. Where there is clear evidence of transmission through surfaces, it is often surfaces that are in close to people's faces, where we've seen things as like shared cell phones, headsets, for example, in processing plants, where people might wear a headset with a microphone, etc. Those are the higher risk surfaces. As we move further away from these surfaces, the risk is smaller and smaller, and it's not the major concern there.
All right, another question. Shouldn't we not be eating raw, uncooked vegetables and salads since the virus reportedly likes cold environments like the refrigerator and heat kills it? Other people also touch vegetables at the store. Maybe we should cook all of our food?
Well, I'll go here again, and this kind of goes back to a lot of what Martin has already been talking about. All right, there is, always there's a theoretical risk, right? But when we look at what's really going on and what's really happening, right, the risk to us from transmission through foods like uncooked vegetables is very low, right? Number one, and some people have talked a little bit about, how often people are using face coverings and things like that. But how often, and maybe people have seen it, I have not seen it when I go to the grocery store, and even before COVID-19, right? How often do you really see people sneezing on produce, right? We react pretty viscerally, even before COVID-19, when somebody sneezes on your food. So there's a lot of, already practices in the grocery stores on time that the people that work there are not going to be sneezing, right, on the food. So it's probably then going to be maybe someone sneezes on their hand and, to cover their mouth and then touches something. But also when you think about transfer rates, right, they're not perfect, right? Just because you sneeze on your hand and then you touch something, it's not like all of a sudden all the virus goes from your hand to that surface. So there's reduced transmission there. So the load is going to be low, right, if it goes that route. And then, as Martin mentioned, this virus, right, is not very stable outside of the body. It has a half-life. Someone asked in the chat box, what is the half-life? It depends on the surface that it lands on, but it's usually somewhere between 3 to 6 hours, depending on the material. So it's constantly then, as it sits there, inactivating over time. So again, the load gets lower. And then when you get home, right, as we talked about handling produce, all you need to do is, follow the standard procedures that you would have followed with your produce already. You're going to wash, right, with just water, the outside of the produce. If it's something like a lettuce or, an avocado, you're going to remove the outer layer anyways. That's what you do to naturally just clean, right, the outside of your vegetables. And then you can go and use it to make a salad and eat it and things like that. So again, the risk is very low, and it's not something that I would be worried about actively managing or avoiding these type of foods, especially because they're so also important from a nutritional sense. So.
All right, another question. Is it safer to purchase food directly from a farmer, if possible, the grocery store, or online? So which of those mediums is best?
The only thing I would consider there is where can I minimize the risk of close person-to-person contact? With that, online for myself is probably the safest because there's the least person-to-person contact. Grocery store and farmer depends. If I'm in a busy farmer's market that's not very well organized, where there's a high risk of me being close to people, social distancing isn't practiced very well, it's not set up, I prefer to the grocery store. If it's me and the farmer on a field with 6 foot distance and a busy grocery store, I pick the farmer. So again, remember, it's all about the personal distancing, and that's the key driver there for yourself. Now, there's another way to think about it. There's the way to think about how much close personal contact with any people happens for a different transmission. You think about online, food has to be packaged, food has personal shoppers go out potentially. There's still other people that are in close contact with each other. It's just not you, so you are protected. So if you take that point of view, you might be better off. You might not be better off by a farmer, but overall, US transmission risk might be off by a farmer because the overall person-to-person close contact is shorter because the supply chain is shorter. maybe this gives us a new concept, right? In food miles, the food close contact interactions in minutes, and that might be less if you buy direct from a farmer. But again, all about social distancing. That's what you need to maximize, minimize close contact, and you pick the route that helps you to do that.
Great. Is there a risk of infection if a food service worker coughs or sneezes on prepared food or food containers that are then brought into the home? So this question in relation to, takeout.
Takeout, right. So again, we'll take a little step back, right? So pre-COVID-19, right, we still, even during COVID-19, we have other viruses that we have to worry about, right? Norovirus, hepatitis A, that have all been issues in the food industry. And so there are a lot of standard practices, right? Hygienic policies in place for food service workers to, right, minimize, right, the chance of anything, right, getting into your food, right? And in this heightened environment now with COVID-19, these restaurants and food service providers are even more cognizant of watching these practices. And then we've also already kind of talked about, again, right, the risk of, right, COVID-19 actually being consumed and, goes into the stomach. You have the acid there that will then destroy the virus. It's not a major source, right? Now, when we talk about the outside of packaging, Martin has also talked a little bit about that previously, on the packaging at the store. I don't know, when I've done delivery, right, most of my food comes double bagged. So if you're concerned about the outside bag, right, you can carefully open it up, remove the packaging that's inside, right, and then put it on your counter. And then if you're worried about the outside of that, you could also transfer that food into a new container in your house, dispose of the takeout container, and then make sure that you're washing your hands with soap and water. But again, the most critical, right, piece of breaking the route of transmission when you're touching anything, right, is, and you should have been doing this anyways, right, is washing your hands with soap and water, right, after you're contacting things that may be dirty, and then making sure to wash your hands again with soap and water before you eat. So that's how I would address that.
Thank you. Can I get COVID-19 from a food service worker at a drive-thru if they are not wearing gloves? So this is going along very lines.
I guess we're kind of going through different scenarios, but we always come back to kind of the same points. So I guess a drive-thru. So the question is, a food service worker is infected and shedding the virus, and then they hand me my bag or box of food and beverage without using the gloves. And so can I get infected from whatever contamination occurred when they were, in contact with that bag or box? So again, the answer is highly unlikely. For one, as we talked, so the transfer from person's hands to packaging, from packaging to your hands, and then from your hands to your face, mouth, nose, eyes, would be very, very minimal. So therefore, it would be very unlikely to cause any infection. And especially if the package is paper or cardboard, or any other porous material, from which like recovery is actually also very low compared to other surfaces. But I know there's still a chance. So this is why the next step, when you get to the bag or box of your food that the food worker touched, you will not touch your face. You will wash your hands, or you will use a hand sanitizer. And then finally, before you eat that food, you will wash your hands, and again, at least use a hand sanitizer. So just touching, if there's a potential contamination on the food packaging and you touch it, just by doing that, you are not going to get infected. You will get infected when you take that contamination and put it to your eyes, nose, mouth, so be wary of that, like not touching your face, very important. Wash your hands, use a hand sanitizer. When you come home, before you start preparing food, before you eat the food. very important.
All right, next question. Essential workers such as grocery workers must show up to work. Their temperatures are taken on their way in. What if they are asymptomatic? According to certain research, there is a 25% rate of people who are infected with COVID-19 and do not know it.
Very good question. There's definitely, temperature checks are not perfect. If you do temperature checks, there's still a risk that you admit people to a work environment that could be shedding COVID-19. They could be asymptomatic, or what's called pre-symptomatic, means their symptoms are going to show up 2 days from now, and at the time you test them, they don't have fever yet. That's a risk. This observation is one of the key reasons why we moved to the recommendation of wearing face coverings or face masks, because it's those pre-symptomatic or asymptomatic individuals where them wearing a face mask really reduces the risk of transmission tremendously, because when they cough, when they speak, which also creates some droplets, those droplets just don't fly out of their mouth as they would without a face mask, and therefore the risk of transmission is considerably lowered. The other thing to consider is that, you know, we have situations where people have been out of work, out of a job, and they need a job because they have a family to feed and other responsibilities. And we have seen even instances where people take medication that reduces their fever in order to get admittance to their workplace because they just simply need the money. It's a sad situation, but it is one of the realities, which is another reason why temperature checks alone will not work. They got to be part of an overall system, and that includes, you know, paid sick leave, etc., to not set people up with incentives to come into work when they are sick.
Right, so a key message there is that it can spread even if people are asymptomatic as well, which was one of the questions that was asked earlier in the chat box. So just because someone doesn't show a fever doesn't mean that they couldn't still be shedding the virus. There's also another question along those same lines in the chat. Is it true that we need to wear shades or glasses, and if so, why?
The risk there is if you would get, you know, the mucous membranes of the eye can be another route where the virus could go into your system, and so that's where this is coming from. It's a much lower risk than if it gets into your nose and directly in your respiratory tract, but it is one. So that is one of the reasons why, particularly if you're in a closed high-density environment, for example, in some of these meat packing plants, in some of these food processing plants, or even in some of the car manufacturing facilities reopened up, that can be another protective measure. I've not seen that much about how important shades or glasses are, so I don't know, Sam or Al, if you have seen anything, but to me, it's lower on the list than face coverings or face masks, but you know, it is another way that could reduce some risks. Same caveats that apply to face masks apply to if you spend a lot more time touching your face and doing some other things that might increase your risk of transmission. The net effect of wearing glasses might not necessarily reduce transmission. Sam, Al, anything else you've seen on this topic?
Yeah, I think the only thing I'd add is that, right, it is around how much exposure you're getting, right? So again, it's when you're being in close contact with a lot of people, particularly people who might be sick. And so that's where you see it in the food processing plants, but also in healthcare settings, right? That's really where it adds another layer of protection. But for the average person, you're not going to be exposed to that level of virus. And so I think that's why it is currently not being recommended. So.
And that's really good point, Sam. I think sometimes people, again, it's like it can't hurt sort of approach to things. It's like, well, if nurses that work in an ICU where people are intubated wear eye coverings, where you have a very, very high load with that intubation process of virus in the air and a very high risk of spreading, wear eyeglasses, why shouldn't I? Well, if you go through this sort of training, and I'm a veterinarian by training, so I know a little bit about it, you get really beaten into yourself how to behave in an ICU, to not touch your face, not touch yourself, and every time you do, you get kicked out and you rewash your hands. Most of us are not trained to do that. So if we wear eyeglasses, particularly ill-fitting ones, and face masks, our risk of touching our faces and doing other things that increase the risk of transmission are there. So we can't just, it goes back to the helmet analogy. Should a race car driver wear a helmet? Absolutely. Should I wear a helmet when I drive my kid to school? Absolutely not. Same with some of these other protective practices. There needs to be context, and we need to be careful about that, because otherwise we put people under greater risk than we prevent.
All right. Another question on reusable bags. This was a popular question that folks had when they submitted questions. What's the best material for reusable grocery bags and how to clean them?
Yeah, I guess it was already covered. The reusable bags are perfectly safe. And generally, you're the only one handling the bags. When it comes to concern about environmental contamination, again, highly unlikely. We're talking about transfer of virus from surfaces, then from surfaces to bag, from bag to your hands, and then from your hands to your face. Long chain, very unlikely that you're transferring anything from it. Again, very important part is when you come home, you wash your hands. When you take everything out of your bag, you launder the bag. If it's the kind of bag that you cannot launder, it's like plastic, use an ethanol wipe, 70% ethanol, 70% isopropanol. So if I had to choose between materials, I would say the kind that you can launder, just because it's more effective and easy to clean and after every use. So.
Yeah, and I will add that we have an infographic on addressing that question in our website under the infographics page. All right, and then along those same lines, a lot of questions on food service and people who are preparing food. Should they be wearing masks and gloves?
All right, I'll jump on that. There's always the gloves versus no gloves debate. And many times in restaurants or food preparation areas, right, it's driven by local, right, regulations. But at the end of the day, right, gloves get dirty and they can act as a source of contamination just as easily, right, as a hand. They can transfer bacteria or viruses from one place to the other, right? And so that's why, if it's someone working with their hands, they need to be regularly washing their hands with soap and water, right, for at least 20 seconds. We know that this is an effective way to inactivate and remove the virus, right, due to its lipid envelope. If they're using gloves, the gloves need to be frequently changed for that same reason. Now, I would note that in this COVID-19 environment, right, where a lot of PPE, including gloves, have been difficult for places to get, I personally would rather see someone regularly washing their hands, right, with soap and water than trying to extend the use of their gloves because they don't have enough, right? So I would think about it that way when we're talking about gloves, right? They should be following the correct practice, either washing their hands or making sure they have enough gloves that they can regularly change them. So if you see someone with gloves, it may not mean, right, that it's safer. So think about that. As for masks, right, again, beyond COVID-19, right, we have general hygienic practices, right? And, anyone who was sick anyways that's showing symptoms of coughing, sneezing, fever, they shouldn't be preparing food in the first place, right? They should be at home and they shouldn't be coming into work to expose their coworkers. Now, Martin mentioned, right, there's always the risk of the asymptomatic spreader. And so when I'm thinking about someone preparing food and then you may be handing it to the public, right, we already know that the regulatory requirements here in New York State are that, if a food service worker, food preparer might be engaging with the public, they should be wearing a cloth face covering. And if they find themselves in situations which are, probably typical of like, the back end of a restaurant or a prep area where they might be coming in closer contact with people that is, closer than 6 feet, they should also be wearing cloth face covering. So in that sense, right, If they find themselves in those situations, they should be wearing cloth face coverings, right? And that's how I would address whether or not you should expect them to see wearing masks and whether or not they should or should not be using gloves. So.
Thanks, Sam. All right, I have cans in my pantry that expired, but can I eat them during the pandemic to reduce how much I need to go grocery shopping?
Yeah. So canning process involves sterilization that inactivates all microorganisms, including spores. And because a can is a hermetically sealed container, the food in it cannot get recontaminated again. So the answer would be yes. You can eat canned food past the expiration date. So usually you would find best before date or use by date, which is actually referring to the quality of the food, not the safety. Even though there are no microbes in a canned food that would spoil the food, just on a chemical level, there are changes happening in food and that can that is kind of degrading the quality of the food. But if you're okay with eating that food, it smells okay, it tastes okay, the texture is okay, then you're okay to eat it. I think what is important is to inspect that can, regardless of if it's within the code date or not. Any damage, rust, holes, dents or leaks. If it's bloated, like do not eat that. Immediately toss that can away. So I think the shelf life of cans is up to 3 years. So when I say it's safe to eat, I don't know, I would not go past 3 years beyond that. But in general, it is safe because it's a sterile product.
Thanks, Al. There's also a couple of good questions in the chat here. One of them, all right, is there likelihood that the antibody test will be implemented on larger scales to confirm who may be pre-symptomatic or asymptomatic before they return to work? So the goal here would be to limit the future spread of the disease in coming weeks.
So this is Martin. So there's a lot of unsubstantiated optimism about the use of these antibody tests. They're not going to be valuable for individual decision making, such as should someone come back to work. First of all, it takes a while for people to develop antibodies. That you can be sick, you can be pre-symptomatic. At that stage, you may not have antibodies. It could take days or longer than that. So it will not be useful to detect pre-symptomatic people. If you have antibodies, it also does not mean you have the virus. Importantly, there are two different types of antibodies that's tested for. It's IgM, which is the antibody that happens first. So you get infected, you first develop IgM antibodies and later on develop IgG. There are some companies out there that recommend that you test for both, and then they use that combined information. So if you have someone that has IgM only, the infection happened within the last, 3 to 4 weeks, and therefore you can't be sure that they're cleared of the virus. And so then you need to go back to a virus test. So the only way to make sure that particularly people that had symptoms or when they're ready to come back to work or otherwise tested is really a virus test. The antibody test can give you a pretty good idea how frequent the infection was in a group. Have you had a lot of infected people, fewer infected people, but sort of an individual person decision making, just not very useful. It also, despite what people think, we are not at a point where you could use an antibody test to say, okay, this person, you don't need to worry about getting it because you have high enough antibodies. We really don't know exactly what levels of antibodies are required to protect people against subsequent inflammation. So yeah, interesting from a public health perspective, not so valuable for individual decision making.
And a follow-up question there, Martin, how long can an asymptomatic person spread?
We're not quite sure. It's not an experiment you can easily do because you basically would have to test a person multiple times, which sometimes has been done. I think the rule of thumb is probably 7 to 10 days, but it doesn't mean we're not going to have some of the people that might spread it and might shed it for a longer time. It can get very, very confusing too, what this really means. So you could have, there are these rare things that happen. So you could have someone that's positive, then tests negative, then tests positive again. That could be because the test didn't work, right? It could be because the nasal swab wasn't taken right. The technique for taking the swabs is very, very important for you to get a reliable result. So I think rule of thumb is 7 to 10 days, but I guarantee you there are people who could shed it for longer.
Okay. Another question on guidelines for sanitizing money. So are there any guidelines on sanitizing money, coins or paper bills? We have had this question from farmers market vendors who only accept cash. Should they not touch it for a few days, disinfect it, or just always be sure to wash their hands and not touch their face?
They should be, there are no recommendations to disinfect or sanitize money or paper. And it can actually be hard to do, right, with dollar bills. So yeah, primarily, right, it's going to be washing your hands and not touching your face when you're dealing with it. I will note that on some of the studies that are out there on the stability of COVID-19 on paper-like products it's one of the types of materials that it degrades the fastest on. So again, lower risk there when you're talking about bills. Another opportunity there is if, you are handling a lot of money and you don't have access to hand washing stations or to sanitizer, right, that has at least 70% ethanol. That might be another case if you have access to gloves, that you could use gloves and then change them after each handle. But yeah, you don't need to disinfect and sanitize the money.
And another question, can COVID-19 live on our clothes? And if so, how long?
So I'll jump in on that a little bit. So there again have been some studies trying to look at the stability of COVID-19, the virus on different materials, and some have looked at clothing and paper and stainless steel and plastic. And when we're talking about paper and clothing, those are on the lower end of the survivability. Again, you have to remember a lot of these studies are done in laboratory settings, so they inoculate, right, the surface or the clothing or the paper with very, very high loads of virus so that they can actually then measure a decrease in that virus over time. Because if you start too low, you can't detect it, right, with our methods. So they start with a high load that we wouldn't find in typical situations, and then they measure that reduction. That's how they do it. So, and then for clothing, and one of the papers that I read, even to then get a virus to detect whether or not it was still there, they had to then soak the cloth in a large amount of water and then test the water that they pulled out of there, right? Because just touching the cloth, right, and trying to extract the virus doesn't happen very well, right? So that transfer is very, very low. And you're not going to sit there and soak your clothing in water and then, drink that water or something like that. So the risk from clothing is low.
And you probably would have to snort the water up your nose to get exposure to it, so on top of it. So I think this is an important one to keep in mind if we talk about this transmission through surfaces. So very typically with other viruses, if a virus gets deposited on a surface and then you touch it, even if it's a fairly smooth surface, you might pick up 1% of the virus. So 1,000 viruses on a surface, I touch it with my finger, I probably get 10 of these virus particles on my finger. Then I touch my face with that finger. Again, not all 10 viruses on my finger are gonna jump on my face. Most of them are stuck to my finger. Maybe every now and then 1 out of the 10 will move. If I pick my nose with it, when the nose is wet, that transfer is gonna be more effective because it's easier to move from a dry surface to a wet surface than if I just touch, sort of easily touch my face. Now, if you take that to clothes, right, and think the virus will attach, soak into it. So that transfer coefficient of 1%, or we call it, is probably going to be considerably lower, which is why we say the risk is so low. Taken from other, examples of actual true foodborne diseases, there are very few examples of transmission through clothes. There's one with salmonella that most likely occurred through that from a reptile. too close to a baby, but then, you know, if you hold a kid in your arms with their face close to your, you know, let's say sweater, and you have high levels of salmonella on that sweater, that could lead to a transmission event. But it's scenarios, extreme scenarios like that, and that would not work with COVID-19. So risk excessively low of transmission so close. Under normal circumstances, again, I'm not talking about the nurse or the doctor that works in a ICU where they intubate patients. We always need to consider that.
Another question, can ozone, such as using an ozone generator, disinfect a shared space when it's vacant?
I don't know, Sam, do you remember I don't think ozone has been proven to work against COVID-19. I think in general, that will be overkill.
Yeah.
Potentially, and I think, you know, there's exposure risk. So again, the simple surface sanitation is really all that is needed.
Yeah, at the moment, EPA, so Environmental Protection Agency, is only evaluating chemical disinfectants and sanitizers against it. They're not testing equipment, and to generate ozone, you need equipment. But I think that's also changing. I think they're going to test some of the equipment. Also, when it comes to ozone, you have to be careful about people exposure to ozone. There's a certain limit that you have to follow. So on one side, yeah, we don't have information about the effectiveness. On the other, we know it can be harmful to people. So yeah, I don't think maybe it's a good route to go. And again, I would emphasize that surface contamination is not as much of a risk than the risk of transfer from person to person. So I would really, if you have extra energy, time, invest in that, how to make that person-to-person contact even more strict, you know, how do you maintain that social distancing and so on.
All right, with that, I am out of most questions in the chat, and if I missed one, feel free to copy and paste it or unmute yourself. So I'd encourage any of you who have questions to unmute yourself now, or to press *6 if you're on the telephone.
I have a question. Can you hear me?
Yes, I can.
I did put it in the chat box, but I was wondering about the canned foods. And what is the basis for the 3 years as far as the shelf life of canned foods? I thought canned foods, as long as the seal was intact, they were safe indefinitely.
I just answered this in the chat. So yes, you are right. As long as the seal is intact, the content should be safe indefinitely. The important part is to check, you know, if that's, you know, if that can is intact, you know, so are there any holes, leaks, dents, and so on. And if you think about the likelihood of, you know, these kind of things occurring, like rust and dents and holes, the longer you wait, the more likely it is something like that will like occur. So my personal opinion is that it's not good to give any advice about safety of food indefinitely, you know. So okay. I think it's good to put some sort of a limit. Right. I put a 3-year limit. It's my personal limit because I think like average can has a date of 3 years after it's manufactured. So I'm saying if you double that, kind of that's the limit. But you are right. If the seal is intact, it's safe. I'm not here to say anything about the quality. What's the texture? You know.
Right. Understood.
Yeah, I like to emphasize that that canned foods are good as long as they are intact. And typically, especially they're not acidic. More of the rust and corrosion happens with acidic products like canned fruit. But other things like beans and things that are not acidic, the expected life of those products is really many, many years. The only issue will be some losses of nutrients such as vitamins over time. So it is always important to keep that in mind, but the regular nutrients, proteins, the lipids, the sugars, the general nutrition will be there.
Thank you. Great responses. Appreciate it.
Thank you, Olga. I received another question in the chat about, if we were to have a future vaccine, kind of the efficacy of what that would look like. If we had a vaccine that was offered to the public, do we know how effective it would be?
So vaccine, I mean, there's no way to predict how effective a vaccine would be. I mean, typically there's certain requirements to be met. I think, personally, I mean vaccines, obviously there's a big hope there, but we also need to realize that at least some emerging evidence that some of the symptoms of COVID-19 are immune mediated. So where the things you see is because the immune system basically overreacts, including some of the emerging evidence of the symptoms that could be or long-term consequences of COVID-19 in children. So as soon as you have symptoms like that, a vaccine development or this and deployment can be even more challenging, because there are situations where a vaccine may actually make the disease worse in some people because you have a stronger immune response. And so, all of our hope is we have a very effective vaccine that can be very easily distributed, and that may be the case. But, there are going to be some hurdles, and I think in terms of what we learned over the last few weeks, those hurdles might even be a little bit bigger than what we thought. I could even imagine situations where, vaccine is approved for certain people, age ranges potentially, but a lot of this is speculation. The point is we have to very carefully manage expectations here with regard to vaccines. I'm not saying it couldn't happen that we have a perfect vaccine sometime soon, but there's I think some major hurdles to clear there.
Thanks, Martin. Any other questions from the audience here? I'd encourage you to put it in the chat, unmute yourself, or press *6 to unmute yourself on the phone.
So there was a technical question about half-life. Did I understand COVID-19 as a half-life of 6 hours? So a half-life is basically where we go from 1,000 viable viruses to 500, then from 500 to 250, etc. The last time I looked at the data, depending on the surface, it ranged somewhere from 2 to 3 hours to 8 to 9 hours. It depends on the surface, it depends on the conditions, etc. But that's what we're talking about, sort of a range of half-life, But if you were to put that under acidic conditions, for example, your half-life will change. So a lot of influences on that.
Right. Humidity, temperature also, right, influence then.
Right.
Yeah.
So.
If you look at the half-life in water droplets, it's just 1 hour. So it really depends on conditions. And I would really focus on that it's basically a very short half-life, and also that the expected contamination is very low. So in combination, both of them are result in a very low risk when it comes to contact contamination or transfer from surfaces.
So first of all, I want to pass along compliments. This has been one of the best presentations we've had on this, with this really great information. But I'm wondering whether or not we can kind of back into, as we talk about the half-life, do we have a number as far as the number of virus particles you'd actually have to get onto your face in order to infect yourself? So you can kind of take that number and back into the, okay, so 1/100th of that would come off your hand and 1/100th of that would come off the surface. So do we have a number for actual number of virus particles to successfully infect yourself?
So this is Martin. There's no good number, because again, it's risk-based. And the way that works is that even one viral particle can cause an infection, but with an extremely low likelihood. We don't know what that number is, but probably most of your expert will put it in a range of 1 of 100,000. On the other end, expert guesses, and that's what they are, is that probably once you hit about 1,000 viruses, the chance of infection is going to be pretty high, 50% plus. And so therefore, you know, so that's what, so when we back out all these calculations, and I can do the back of the envelope, right? Someone sneezes on your food packaging. All right, let's say maybe deposit 10 to the 5 viruses, so 100,000. You touch it almost immediately with no die-off, you know, in exactly the right spot where that person sneezed on. You probably need to rub your finger pretty broadly. Then at most you get 10 to the 3, that's 1,000. Now, you know, you're not gonna pick your nose, but you're actually just gonna touch your face, a non-moist surface. That brings it down to 10, less than 10. At that point, the risk of getting sick is significantly less than 1,000, 1 in 1,000 probably. So that's sort of the rough back of the envelope math that I personally, this is not something I would publish in a scientific journal, etc., but this is the logic I would apply to the best of our knowledge that we have right now. Somehow we would back off that math. As that a lot of uncertainty around, a lot of unknowns around it, but that gives you a rough estimate. So under a total worst case scenario, you know, that's that may be what it is. But that is, and that also probably assumes you're highly susceptible, et cetera, et cetera.
I think that highlights the point, right, Martin, that really, you know, we spent a lot of time in this session talking about, you know, the risks through food and through surfaces. Really, the risk is through continued exposure, right, from close person to person contact, where that kind of stuff is happening, you know, 100 times more frequently throughout the day, right? And that's where the issue really comes through, right? So when we're talking to people who are concerned about catching COVID-19, it's really about, you know, controlling your interaction with other people and limiting that control the spread.
Right. And when I breathe it in, I eliminate 2 transfer coefficients from a surface to my finger, from my finger to my face, because the droplets more or less conceptually, if you're close by and someone sneezes, more or less go from one person and breathe it into the other person, and you have this direct transmission event where you just eliminate those 2 low transfer coefficients. And those transfer coefficients of 1% are probably smooth surfaces, right? As soon as your surface gets rougher, et cetera, the transfer coefficient goes down. Yep.
Thank you. Next question. New York State is now in a reopening phase. Does the group have any impression on what amount of increased cases a region or state would incur to close community activity again?
So I think there's a guidance out there. Someone helped me. It was a certain number of cases per 100,000 over a week, at which point they would go back. I think it was in New York.
Right, yeah, I don't know the numbers off the top of my head. I have to go back and look. But yeah, I think there are 5 key metrics that at least New York State is looking at on when you would close down, and it is around what is the increase in hospitalization rates, I think the increase in overall positive cases of COVID-19, and the increase in deaths, and then kind of you see it related to that then is also the capacity of the healthcare system, right? And if the capacity for, I think, hospital beds and ICU units both drop below 30% excess, then that would be another reason for them to clamp back down. And so, yeah, there are specific numbers on the New York State website.
Yeah, so to clarify, kind of the criteria for reopening, if that criteria were to be suddenly not met, you would go back to being a closed region. Is that a fair assessment?
Right, then they would be talking about then, as Cuomo says, closing the die or closing the faucet, right, and putting back in restrictions in place.
All right, we have 4 more minutes left, time for maybe 1, maybe 2 more questions. How long does COVID-19 last in a frozen environment?
So, yeah, so the frozen environment, right? So we know that the virus, right, is susceptible to heat, and that will inactivate the virus. So technically, right, if it's frozen, that's how we store a lot of our bacteria and our viruses in the lab. So it would not degrade as quickly in a frozen environment. But again, it all goes back to what is the load level and the risk and things like that we've been talking about a lot. And if we're talking about frozen foods, again, that transmission risk is quite low. That I wouldn't be worrying about it being transmitted through frozen foods.
Again, the deterioration rate is lower when it's frozen, but even in that frozen state, it's not cut off where it's like preserved. It still depends on temperature. Sam said we're storing our bacteria and viruses in frozen state. We store them at -80 just to really make sure that they are stable in that state. So even in the frozen state, there are differences in how stable it is. Plus just the process of freezing it and then thawing it. That's another kind of stress condition that's inactivating the virus. So I would not worry about.
And again, it's not foodborne. If you ingest it, it will be inactivated in your stomach. So then we're back to, okay, what if I touch my frozen food? Now, remember, if it's the frozen food, it would have to, it's often the food itself doesn't have a smooth surface. And it's like, well, what if it's the packaging? Okay, the packaging has a relatively smooth surface, but that's also the one that freeze thaws the first. So that's one where you then see more rapid inactivation. And the key message, again, people can't do 1,000 things. Hand washing, hand washing, hand washing. If you learned one of them, in addition, I shouldn't say hand washing, social distancing, social distancing, social distancing. After that, hand washing, hand washing, hand washing. Those are the two simple things. We've seen it. If people do too much, to spend all the time unpacking, repacking food, most of them, the vast majority of them, will neglect other practices. The hand washing part is important before you eat, after you touch things. And to a certain extent, that was always true because other pathogens can be on the outside of food packaging too. And I think we had one question, Anika, I'm not sure whether we answered it. It was about other food safety risks. And I think that's another one we haven't talked about. So there's two parts. As we do a lot of this handling, there's some, very convincing sounding doctors that I think for a while recommended to store your food in the garage for 2 days before bringing it in. If that's food supposed to be refrigerated, or even if it's 3, 4, 5 hours, the risk of, bacteria growing can increase. So there are certain things, unintended consequences of some of these potentially well-meaning strategies to reduce COVID-19 that then increase other food safety risks. And on the other hand, there's obviously a question, does FDA do less inspections? Does USDA do less inspection? Does that increase food safety risks? Very, very unlikely. It's the food companies that do food safety. FDA is there to double check in most cases. There are some scenarios where overall risk of foodborne illnesses might increase. Partially it's because the public health system is overwhelmed with COVID-19. So foodborne disease outbreaks aren't going to be detected as easily. And that may then mean an outbreak is bigger before it's detected. So some other issues. So, net, I probably expect there's a potential for somewhat more increased number of cases, but also all our consumption practices have changed. We moved from restaurant to home cooking. A lot of it depends on how well people cook at home or practices they observe. And frequent hand washing will help with everything there. Probably bigger risk of people cooking that are not used to it and cross-contaminating raw ground beef on their salad. With frequent hand washing, we also reduce those risks.
All right, a lot of information shared today, and we are out of time. I wanted to thank the panelists and all of you for tuning in. And I'd really encourage you guys to check out the Institute for Food Safety website in the COVID-19 resources. And if your questions aren't answered on the webpage, please feel free to reach out to us. You can get our contact through that webpage. So please take a look at that, and thank you for tuning in.